More than half of the residents in a Henderson nursing home contracted COVID-19, according to the state's COVID-19 dashboard. Now, out of the reported 104 residents with the virus, 29 died. It's a story the I-Team has been following about outbreaks inside of nursing homes. And now the granddaughter of a woman who passed away says she wants answers after her family was kept in the dark. The I-Team's Vanessa Murphy is in studio tonight with what she learned about this case. Vanessa?
Denise, yesterday would have been Maxine Williams' 90th birthday. Her granddaughter says she understands there is a pandemic and people are going to catch COVID-19, but she has questions about how the nursing home where her grandmother lived handled the situation.
My grandmother died alone in the hospital.
Maxine Williams died of COVID-19, according to her death certificate. Erin Jones says her 89-year-old grandmother had dementia and was a resident at Delmar Gardens in Henderson. On July 17th, her family received a call that Williams was taken to a hospital by ambulance.
No one at the facility knew anything. They didn't know what hospital she went to. All they could tell us is she went by ambulance to a hospital.
After several calls, Jones says she was able to confirm her grandmother was taken to St. Rose Dominican Hospital's Siena campus, where she died.
They sent her to the hospital on a Friday afternoon and she passed away in the emergency room a couple hours later. She didn't even make it to be admitted.
Jones has questions about the days leading up to her grandmother's death. The I-Team examined 130 pages of medical records that her family says they obtained from Delmar Gardens. On July 8th, Williams had a cough and was prescribed medicine. On July 13th, she was tested for COVID-19. The cough was on and off through the 15th. On the 16th, test results came back positive for the virus. By then, Williams had a low-grade fever. She was given a nasal cannula for help breathing, and records show she was so uncomfortable she was moaning. On the 17th, her oxygen level dropped to 75. Medical staff noted that 90 to 100 is normal. That's when an ambulance was called.
How did it get that bad?
According to these records, staff reached out to the family 6 times over the course of the 9 days to provide updates, but the family disputes that. Jones also says the family was not allowed to communicate with Williams by phone or FaceTime as requested.
There was something going on they weren't telling us about.
The attending physician identified in medical records is Dr. Charles McSwain. It is unclear from those records whether he examined Williams in person before she was taken to the hospital. When reached by phone, Dr. McSwain told the I-Team during that time he was not making regular visits and declined to comment further. The I-Team also obtained state inspection records for Delmar Gardens. The month Williams died of the virus, there was one violation with at least 6 different components, according to the Department of Health and Human Services. This report dated July 1st states the facility did not have sufficient infection prevention and control. It is noted one resident who was being monitored due to a fever and cough was in a room with a resident who had no COVID-19 symptoms. Their beds 2 feet apart. The report also noted disinfectant cleaner not being used properly and laundry staff not wearing proper personal protective equipment or PPE.
In hindsight, it kind of felt like she didn't really have a chance to not get infected.
By August 13th, Delmar Gardens provided retraining and made changes to address the deficiencies. According to this document, no deficiencies were found in 2 additional visits. As of February 19th, the state reports 58% of residents contracted COVID-19. 29 of them died.
I just want someone to be held responsible.
I reached out to Delmar Gardens. I called the nursing home 3 times since December, and I also reached out to the corporate office 3 times. My calls were not returned and no statement was provided. We'll continue to follow this story and bring you any updates.
Vanessa, thank you for that report. Medicaid in